Utah Driver Handbook, 2023 to 2024 Yearly Edition. Section 13, Physical Health Problems and Driving Safety. In 1979, the Utah State Legislature made provisions for increasing highway safety while allowing many people with health concerns to drive within appropriate safety limits. The law states that individuals are personally responsible for ensuring that they are in reasonably good health when driving. If a person has a health condition that may affect their ability to operate a vehicle safely, they must report it to the driver's license division and are expected to seek competent medical evaluation and advice. Their physicians are responsible for advising them about their health as it relates to driving safety. A physician does not have the authority to restrict anyone's driving, but is responsible for reporting a patient's health status accurately. This report may permit an unlimited license, one with restrictions, or, in some cases, a denial of a license for safety reasons. Now, the legislature also set up a driver's license medical advisory board to advise physicians and the driver's license division. The board emphasizes the functional ability to drive a vehicle safely, rather than stressing impairments in development of functional ability evaluation medical report or guidelines to help physicians advise their patients and simplify reporting. The guidelines include possible health concerns in the following 11 categories: A. Diabetic and metabolic conditions. B. Cardiovascular, heart. C. Pulmonary, lung. D. Neurologic, nervous system. E. Seizures and other episodic conditions. F. Learning, memory, and communication disorders. G. Mental health. H. Alcohol and other drugs. I is vision disorders. J is musculoskeletal abnormality or chronic debility. And K. Alertness or sleep disorders. In some circumstances, it might be appropriate for a medical advisory board to review a case to help determine driving eligibility. Applicants for driving licenses will be asked to answer health-related questions. If there is a health concern, they will be given a functional ability evaluation form to take to their healthcare provider, who will complete a functional ability safety assessment. The form is then returned to the driver's license division, and if appropriate, a license to drive will be issued based on previously determined levels of driving risk. For example, if there is a vision problem and the person cannot read highway signs at a distance, the individual may be considered safe to drive, but at reduced speeds, and restricted license could also then be issued. If you have a health problem, ask your physician how it might affect your driving. Many medications may cause drowsiness or other difficulties. Therefore, a physician may advise against driving until a suitable dosage schedule has been worked out that will not impair driving. Abuse or excessive use of prescription drugs has caused many serious accidents and should be avoided. Individual drivers are responsible for knowing their abilities for driving safely. The guidelines require high standards of fitness for drivers of commercial motor vehicles than for private vehicles, but the principles are the same. Eye test or vision test. The vision requires a 20/40 vision and peripheral field side vision of 90 degrees in at least one eye to pass the vision test. If fail to meet this standard with or without glasses, you will be required to get a statement from your eye doctor. The statement must be presented before your application can be completed. It should indicate specific vision problems and suggest restrictions, if any. A vision test is required on all applications processed in a field office. Everyone aged 65 and older is required to pass a vision examination with every licensed application. Mental and health conditions. Mental and health conditions are just as important as physical health concerns. If your mind is not on your driving, you are probably not driving safely. Some forms of behavior which often provide hints about our mental health are finding that you are always mad at other drivers and sometimes try to get even, tending to be excessively confused or frustrated when traffic becomes heavy, being so depressed and worried about things that your attention is not always on the road, and finding that you are frequently getting traffic citations. Having trouble adjusting to an emotional shock such as losing a loved one. If you are angry or excited, give yourself time to cool off. Take a walk or talk to a friend. Do anything but stay off the road until you have cooled down. If you are worried about something, do something that will allow you to concentrate on your driving. Listen to the radio or sing to yourself. If you are impatient, give yourself extra time. If you leave a few minutes early, you will not feel the need to speed, beat traffic signals, or do other things that can get you a traffic citation or cause a crash. Review examination. Now, sometimes the division will request that a driver appears for a review examination. The request for an evaluation may be based upon a recommendation from a medical professional, confidential reporting, law enforcement officer who observed a driving situation that calls into question the driver's ability to operate a vehicle safely. Another individual or agency which indicates that the driver may be impaired, have a medical condition that requires an assessment of the driver's functional ability to drive. A review examination does not necessarily lead to the withdrawal of a driving privilege. In most cases, upon completion of the review process, a driver is allowed to drive under applicable restrictions if deemed safe by the division. Now, the driving privilege will be withdrawn if an individual does not complete a require review examination. Now, after the completed review examination, a hearing officer will discuss the results with the driver and review the medical evaluation. The hearing officer will take into account the driving needs of the individual, the type of roads or highways used, the traffic conditions usually experienced, etc. Now, the hearing officer will also refer to guidelines established by the Driver License Medical Advisory Board as they relate to the medical form provided by the driver. The hearing officer will then decide whether any restrictions need to be placed on the driver's license. Only when the division determines that a driver cannot operate a vehicle safely under any conditions is the driver license withdrawn. Often no restrictions are required, but when they are, one or more of the restrictions listed in Section 3 are specified on the driver's license. Remember, it is your responsibility to find out about the report mental or health problems, just as you must for physical problems. The driver's license division staff will gladly provide information about the medical guidelines as they apply to the licensing program.